Very good afternoon, everybody. Myself, Dr. Sonu Kumar Singla. I am working as a senior resident in a government medical college and hospital, Sector 32, Chandigarh, from last 2 years. I'm practicing. Before that, I'm practicing in Gurugram from last 5 years. So our today's evening topic is how to understand hypertension. So as we all know, today's discussion will go on the what is blood pressure and how to prevent it. Generally, everybody would like to have healthy or normal blood pressure, but what exactly does it mean? We all have to know this. Basically, each time when the heart beats, it pumps the blood into blood vessels that creates pressure against the walls of the blood vessel. That is known as blood pressure. Normally, in the healthy person, it rises and falls throughout the day, but when blood pressure remains high for a long time and left untreated, it can lead to serious health conditions. In general, persistent increase in blood pressure higher than the normal blood pressure is known as a hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyles choices. For example, patient not taking having regular exercises, patient are obese, patient having smoking, high alcohol consumption, and stress like extra factors. The other risk factors which also increases the risk of developing hypertension, such as age. As the patient gets older, arteries get stiff and narrow. As excess fat builds up in the family history of a hypertension, there is an intake of excess salt in the diet. No eating enough food with potassium can increase the blood pressure and risk of stroke and chronic kidney diseases. The processed foods and the fasting, the fat increases throughout the body and make the heart work harder to push blood throughout the body, hence causing blood pressure to rise. Another one is stress. Reacting to stress in unhealthy ways or not managing stress can also increases the blood pressure. As per agar moving on to hypertension does not have any obvious signs and symptoms, that is why it's often called as silent killer. It puts people at higher risk for several diseases, from cardiovascular problems to the kidney failure to the stroke and even eye damage and blindness. Early and accurate diagnosis is a very important in management of hypertension. Measuring the blood pressure is the only way to know whether person have a high blood pressure or not. Generally, when symptoms do occur, they include headache, tiredness, vision changes, buzzing in the ear, fatigue, nausea or vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It usually measures with an instrument called as sphygmomanometer. A blood pressure recorded in two numbers, systolic and diastolic. A healthy or normal blood pressure should be lower than 120/80 mmHg, or it can also read as a 120/80 mmHg. The upper number indicates the systolic blood pressure, which means pressure in the blood vessels when the heart contracts. Where the lower number indicates the diastolic blood pressure, it means the pressure in blood pressures when the heart rests, when beats. If a blood pressure is more than 140/90, then the person must have a hypertension. Before labeling the person have a hypertension, we must take a 2 to 3 readings and we have to take a mean for the that to label patient as a hypertensive patient. If person have a blood pressure level higher than this, then she or he might at a risk of developing serious heart diseases. These risks can be prevented or reduced by taking healthier lifestyles such as regular exercise, healthy diet, by quitting the smoking and reducing alcohol intake, regular blood pressure monitoring, stress management, and adherence to the medications. If a blood pressure is successfully controlled with such lifestyle modifications, then it might avoid, delay, or reduce the need for medication. So let's take a look at these strategies one by one. First is a regular exercise or a physical activity. Second is which the physical activity must be of 30 minutes per day for 5 days a week. That constitute around about 150 minutes per week of aerobic exercises. Second is a healthy diet. Healthy diet constitutes of DASH diet or Mediterranean diet, eating less saturated fat and getting plenty of potassium in the diet. Limit the amount of sodium in a diet and limit of alcohol consumption. The sodium consumption in diet will be less than 5 grams per day. Then next is by quitting the smoking, it can effectively reduce the risk of heart diseases and improve your overall health. Regular blood pressure monitoring also helps in the maintain also helps in the serious outcomes of the complications related to the hypertension. Self-monitoring helps person to person measure blood pressure at different times throughout the day and over a long period of time. It also helps us in the better prediction of cardiovascular morbidity and mortality rather than the single routine blood pressure measures that occurs during a clinic visit. Stress management. By improving stress, improve emotional and physical health, lower the higher blood pressure. Stress management include exercising, listening to music, focusing on something calm or peaceful or Mediterranean. Adherence to the medication is the uttermost important thing to manage the blood pressure in patients. Adhere to medication is a very important as it controls blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit or healthy life. Adapting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping life by changing your lifestyle and by adding the diet, by quitting smoking, by decreasing alcohol consumption, or by doing exercises along with the medication for the blood pressure management. Keeping blood pressure in the normal range is a very important in preventing cardiovascular complications. It is a very much possible to maintain normal blood pressure levels with the regular monitoring and preventive cares. Hope I am able to clear about any doubts about the hypertension or any understanding regarding the hypertension.